Dear brothers and sisters, I humbly bow, very humbly, to the one who gives me the highest inspiration in my work and in my life, Sri Sathya Sai Baba. It is indeed an honor and a pleasure for me to be here in the presence of this august gathering. I consider you an august audience, not for your qualifications, your degrees, your publications, or for your practice. It is because each of you has chosen to dedicate your life to your patients. That sets you apart. It's because each of you has decided to understand the principles of Sathya Sai ideal healthcare and make that a part of your life. That is why you're august. And I'm truly humbled to be in that presence. I come to you today not as a physician or a surgeon. I come to you today as a patient and as a family member. I think it is very important in this conference and in Swami's practice of ideal healthcare to understand a patient perspective. And so I will go into my character as a family member and as a patient, and with your indulgence, I'll address you as dear doctors. Dear doctors, I'm very happy to be here in the presence of all of you who have chosen to help me and help my family, and to help many other families like mine. That is a unique gift that you have, the gift of love that you've chosen to share with people like me. And I bow to you for that. But you can do more. And you might wonder how. It is by the example that you set from your lives. It is by how you practice what you practice. The loudest words are spoken by your conduct. And so the message of Sathya Sai is spread to other physicians and to the healthcare profession the best possible way by your own conduct. And with that in mind, I ask you to look and revisit your relationship with the patient and with patients' family members. You have given love to your patients, and verily, that's what patients want. But when you see other doctors who fall short of that, work harder, love your patients more so that love goes noticed. Do not have to talk to the other doctors and physicians. You do not have to tell them to love patients. But by your actions, you can become the best beacon of light for those doctors, the light that God has given you as a gift. I'd like to begin, karma strikes again, next. I'm telling myself next and it's working. I'd like to begin with this wonderful prayer that's attributed to Maimonides. As Dr. Nanda mentioned yesterday, Maimonides is one of the best Jewish philosophers of all times. He's also a rabbi from Spain who had to move to Cairo because of persecution. And his thoughts and his words are wonderful. It is a version of how Swami tells us what to do with our lives and our professions. And so here is something for doctors. This is taken from a prayer for doctors by Maimonides. It is said, however, just to correct this, that this prayer was not really written by Maimonides. It's really not clear. Historians are debating about this. But there was somebody else, a German author, Hertz, who might have written this in the 17th century. Maimonides was around the 12th or 13th century. Enlighten my mind, so the doctor is saying this, enlighten my mind that it may recognize what presents itself and that it may comprehend what is absent or hidden. When you see the patient, what presents to you is not all that there is more. Enlighten my mind that it may recognize what presents itself and that it may comprehend what is absent or hidden. Let it not fail to see what is visible, but do not permit it to arrogate to itself the power to see what cannot be seen, for delicate and indefinite are the bounds of the great art of caring for the lives and health of your creatures. It is indeed a delicate act, and it is indeed a divine gift that each of you have to be able to take care of people like me. And so it is important to explore that gift, and it is important to share that gift. You and I are not very different. We are both humans who want to lead a happy life and be at peace with ourselves. But you and I are also very different. Where you see disease, I feel the impact of that disease. Where you see suffering, I feel that suffering. And where you see sorrow and pain, I feel that sorrow and pain. And my only prayer to you as physicians is, please feel what I'm feeling. And that makes you a better person. And that is what I'm going to talk about in the next few slides. That Sathya Sai ideal healthcare and its principles, when practiced fully in your lives, you never step out of character of Sathya Sai ideal healthcare. You are the one who practices that in your life, in your entire life, not just the patient encounter. And with that, you will notice that your own lives will change. Service, as Sathya Sai Baba has said, is not just for those you serve. It is in fact more for the one who serves. And you will find a change in your own lives. But when I need your empathy, the 1 minute that you can give me will make a lifetime of difference for me. The 1 minute you can give me in hearing what I have to say and feel will make an entire magnitude, order of magnitude of difference in my disease, in the prognosis of my disease, in the natural history of that disease, and there's enough evidence to show that, and above all, in my own mind. Sathya Sai Baba says, medicine is meant to promote heart-to-heart and love-to-love relationship between a doctor and a patient. A true doctor is one who realizes this truth and conducts himself accordingly. Sathya Sai Baba does not say that you conduct yourself accordingly during a patient encounter alone. It is your entire life. So we're talking about how you transform your own life. Sathya Sai Baba's ideal healthcare does not begin and end with patient encounters. Because when you want to be a beacon of light for other doctors to follow, for other physicians, you never step out of that character. You never step out of that role. This is the role that you've been ascribed, that you have indeed chosen. It's a profession that you have chosen. And the question that we have to ask when we look around us and see patients suffering, when we see doctors and their arrogance sometimes, or misguidance sometimes, and they're not able to spend time with the patient or understand the disease even. When we see that happening, we have to ask ourselves the two questions Michael Moore asked, and that is, who are we and what have we become? And the answers to those two questions will indeed reveal to us our own transformation, that we have chosen a profession in which we have become doctors, but the question is, are we healers? If you go back to medical history, medicine was widely believed to be the first human science. But somewhere along the way, it lost the human and morphed into a mere science. I am all for science, but I think without the human touch, we should be in another profession. And we must consider that as a serious recommendation. So when a doctor comes to a patient, when you come to me, my mind is thinking, well, here is this one person who's going to address my troubles, my sorrow, my pain. And here's this one person I can talk to. I yearn for that minute of attention from you. And I really, really would like each of you to give me that minute. That is my time. That is my stage. And you're there to only be there to love me. It is indeed a true sacrifice when at that moment you give up what is important for you, what is in your agenda, what is in your mind, and just let it be. Let it be and listen. Because in that listening, you might discover something for the patient. One of the doctors last night was saying that. that in that moment of silence, when you listen to the patient, you might discover something that might help you treat that disease. But you do not just have to treat the disease. You're not a technician. You have to treat the patient. And as I often say, health care, the most important word, the most important part of that word is care. We do not want to just talk about health and how to manage health. We want to talk about health care and how to deliver better health care. In the past, if you look at how medicine was practiced, as I was mentioning in the past, the body and mind were treated as a unified entity. This was long ago when medicine was practiced, 4,000 or 5,000 years ago when we were talking about Ayurveda, when doctors were listening about how to practice medicine from sages and other doctors and healers. It was all about the body and the mind. The two were interrelated. And then somewhere in recent times, and this was around the time of Plato, Aristotle, and Descartes, those were the people who said the mind and body are separate. You've got to separate those two. And somehow from philosophy, that came into medicine. And we were trying to view this as two separate things. And in fact, they are not separate. And in medicine, two of very famous physicians, that one of them was mentioned yesterday, William Osler, and the other one is Wilder Penfield. They both saw the intense connection between mind and body. And this connection is not just an anatomical connection. It is a connection that we may not understand. It's in fact paradoxical. It's paradoxical because we are trying to understand something that is in fact the cause of this understanding. We are trying to understand the relationship between our mind and our brain. And Wilder Penfield at that time remarked, the anatomical understanding of the mind and the brain is much easier than the philosophical understanding of the relationship between mind and the brain. And that is so true. So how do we go and practice medicine? How do we go and practice Sathya Sai ideal healthcare? If you come to me, and I'm the patient, and you're coming to me, how do you practice that? And Sathya Sai Baba tells us how to do it in the next few slides. I have a few quotes from him. But in both approaches, you'll see that the soul is largely ignored, and that is the doorway, that is the tunnel through which Sathya Sai Baba says you can connect the best to the patient. It is more important to know what sort of person has a disease than to know what sort of disease a person has. And this is from Hippocrates. Disease is an imbalance of the body and the mind. It can only be treated when there is harmony in both. And this is a connection. We are all beginning to see this connection. And Jivaka, the physician to Lord Buddha, Buddha was about 500 BC. And at that time, he noticed that there is this connection we are losing. And it's very important not to lose that connection. Sathya Sai Baba says, man suffers from two types of ills, physical and mental. Physical health is a prerequisite for mental health, and mental health indeed ensures physical health. So the practice of medicine, we want to go into one where we want to bio, psycho, social, and spiritual all together. And it is not something that we say has to be put aside as alternative medicine or use words that are disparaging. It is medicine. It is healthcare. And what Swami says is, when you see a person, try and feel what that person feels. And how do you feel that? It is through this connection that we have, you and I have. That you as doctors and I as a patient, we do have a connection. God has created a door from which you can walk out of your door and come into my door. In that minute that I ask of your time, allow me to see God. Because that is the only glimpse of God that I will get during this encounter. I do not want to see a surgeon who walks away because he has to go eat. Allow me to see the God that I've been yearning to see. And you can give me that vision. Well, flip this around. I too am in a similar position, that I can allow you to see God too. During this encounter, when you give me that minute, the joy that you see in my life, the joy that you will see in my eyes, will show you what divinity is. It will show you the value of the gift that you indeed have. That is the true value, the joy that you bring upon myself and my family. Your money is not your gift. Your accolades are not your gifts. It is the joy that you see in my eyes. And believe me, you have to work for that. It doesn't just come to you. Ideal medicine, this is Sathya Sai, ideal medicine is for the physician because it will give you that glimpse of divinity. It will give you that joy. And I'm going to argue also that ideal medicine is for me and my family. And finally, ideal medicine must always be preventive, no matter what subspecialty or specialty you practice. Ideal medicine is indeed for the physician. Why? Sathya Sai Baba says the body, Atma, and the mind are closely interrelated. An attitude of generosity, a spirit of enthusiasm to do good, and to be of service to the best of one's capacity, these build up in the mind as well as in the body. There is some energy that builds up. And believe me, when you are nice to me, when you see that smile in my face, when you see that gratitude, you're a junkie. You're going to come to me more. You're going to love me even more because you want that high. You want that joy. The very joy derived from service reacts on the body and makes you free from disease. Thus, service rendered to others is service done unto oneself. When you go back home, you will lead a better life. And you'll be a happier person. Because the gift that you share with me is very unique. It's indeed a gift like none other that you have. Because when you give that gift to me, when you share that with me, something is created. Divinity is the only thing that creates everlasting things. Everything else is evanescent. Human creation is evanescent, but divine is never. So when you share that love with me, the joy that you see in my face, the happiness that I derive is going to come back to you as joy in your lives. And believe me, that is worth it. And that will make you free from disease, that will make you a better person, that will make you happier. So please, practice ideal healthcare. Ideal healthcare involves an understanding of spirituality. Why? Because spirituality is the doorway through which you and I can communicate. This was a paper published in the Journal of General Internal Medicine in 2006 on spirituality and medicine. This is at Yale University, and they have introduced this course in the medical school now. And the conclusion of that study after introducing this course was that early spiritual training for the physician makes for a better healer. Spirituality, the way they define it, is exactly the way Sri Sathya Sai Baba defined spirituality specifically in his discourse in February of 1993, where he said spirituality is not about rituals. It is not about religion. It is about conduct. It is about a way of life, and it is about values that you espouse. If you don't have any of those three, your rituals and your religion is baseless. It is a castle in the sky without any pillars or foundation. And that's why it's crucial and it is important to have those pillars and foundation, and that comes from the values and conduct that you develop from those values. So spirituality, they find, helps not only the physician, but of course they found in this study of these physicians in training who then go on and interact with the patients, they found the patients were happier. All service that you do to others through love is actually service done to yourself. It is not others that you're helping, it is yourself. And my plea to you, of course, is to help yourself first, dear doctors, because you can't take care of me if you can't take care of yourself. Ideal medicine is for me as well. The conduct and demeanor of the physician is more effective in drawing out the latent sources of strength in the patient than the most powerful drug. Thanks. A prayerful atmosphere of humility and veneration will go a long way to help and cure. So I can talk more about this afterwards, but I'll just skip over to the last slide that I have. There was a study later on that was published as well about this, and there are many studies that show that the essence of Sathya Sai ideal healthcare is indeed an important thing to practice, not only for the disease, but for the patient's welfare. And it helps the patient lead a life that will prevent the patient from coming back to your hospitals. Enrich your practice by practicing preventive healthcare. And then the human values and the importance of human values. I want to sort of mosey over to the last slide. And in the last slide, I want to talk about Brother Lawrence. Brother Lawrence And the reason I'm talking about this is because as doctors, I would like you to truly, truly not just practice Sathya Sai ideal healthcare, walk out of this room and feel that that is the end of this issue. I would like this to be indeed your life and your singular focus in life to be better practicers of ideal healthcare. Make that a challenge in your life so that you can improve on yourself. And in the words of Brother Lawrence is a Carmelite monk in 16th century France. He used to work as a cook in a kitchen. And he says, he's written these letters, and in one of these letters, and there's conversations, and the book is called The Practice of the Presence of God. And in that, one of the conversations, the fourth conversation, he talks about, it's wonderful the way he describes. He says that in my business, the practice of my business is no different from the practice of my worship. Because amidst the clutter and noise in my kitchen, where everyone is trying to say something at the same time, and there is so much noise, I possess God with such tranquility that I feel I am upon my knees in front of the Blessed Sacrament. That singular focus that isolates you from everything else is key to the strength and your determination to practice Sathya Sai ideal healthcare. That is how you become beacons, not by individual encounters with patients alone. You're already doing that, but I ask more of you. And I beg more of you, because that encounter would help me, but I now care about the other patients that you'll be seeing, and I want you to inspire other doctors as well, because the way Sathya Sai Baba has inspired you, that torch has to be passed. And what Brother Lawrence says here is, in the end, we ought to propose to ourselves in this life to become the most perfect worshipers of God that we can possibly be. A change of words in here would tell you that you want to be the most perfect practicers of Sri Sathya Sai ideal healthcare. And I think it's really important to understand the whole patient. Sathya Sai ideal healthcare, dear friends, is not just healthcare for all. It is healthcare for all of an individual. Jai Sai Ram.